Yeah, absolutely. No problem.
Hey, Lily. Hey, Chloe.
Ashling.
How's it going?
Good. How about you?
It's been a long week, my friends. I'm tired.
Almost Friday.
Yeah, we're almost at the end of it.
Almost, almost.
Do you want to unmute and then we'll get, there we go. Almost. Maybe we might want to turn off the background. There we go. There we go. Okay. I think we are kind of ready to go. Sorry about that, y'all. My audio was absolutely not working. I could not hear y'all, and best to my understanding, y'all could not hear me. But I'm glad to be with you. Ashley, is it Asylum? Can you pronounce?
No, it's Ashling. Ashling.
Okay. Well, thank you so much for reaching out and helping get this set up. We're really excited to be here with you all today.
Thank you for making the time. We really appreciate it.
Yeah, so we are Chauncey's getting our presentation opened up. I just emailed it over to her. It might take a moment for it to actually go through our internet, but in the meantime, I would love to do like just a couple of quick rounds of intros since we've got kind of like a small group on the call. Where I'd love to hear a little bit about y'all. I know we've only got this scheduled for technically 30 minutes, but we're happy to stay on a little bit longer to do some some additional questions or anything. But I'd love to kick off by just kind of getting to hear from you all, like maybe name and what you're studying right now, and that would be really helpful. And I guess just to kick off, I'm Emily Lakemaker, the Director of Admissions and Recruitment here at Rollins.
Hi, I'm Chauncey, and I'm the Associate Director of Admissions and Recruitment.
And thankfully, we were both in office today, so it made it really easy to hop in and to be able to do this when my AV was clearly not working. So, Chloe, we'll start with you because I see you first on the screen. So if you just want to take yourself off mute, like I said, maybe name where you're from and what you're studying right now.
Okay, hi everyone. My name is Chloe. I'm a recent graduate. I actually graduated this May. I'm currently in Tampa, Florida. That's where I call home. And I was a biology major and anthropology minor.
Awesome. All right, Lillian.
Hi everyone. My name's Lillian Sorover. I go by Lily. I am a biology major and public health minor. And I'm from Haddonfield, New Jersey, right outside of Philadelphia.
Excellent. All right, and is it Legan?
Lagan, yes.
Like,
I'm Lagan. I'm from LaGrange, Georgia, and I'm a public health major.
okay. Oh, excellent. So I love that. And Addie.
Hi, I'm Addie Anderson. I'm a psych major, public health minor, and I'm from Atlanta, Georgia.
Oh, so you're from where we are. Excellent. Yes. I assume you I assume you're familiar with Emory, or I guess most everybody on the call is. Okay, excellent. Well, it looks like that was our announcement that our presentation just came through. So great timing. We're going to go ahead and get some screen share going on so that way you all can see that. And the presentation that we've got here is kind of designed as our full-length one. So we might kind of scroll through it a little bit quickly as I want to make sure that we're kind of covering all the kind of the highlights in the brief time that we have together. But like I mentioned, I'm going to try to get through this in about 15 minutes. And so if I'm going quick and you have questions, just hold on to them. And this is a small enough group that, at the end, we'll be able to kind of go through and address any, specific questions that you all might have. So don't feel like we're going to just like run off immediately. And I'm happy to stay on a little bit longer as needed as well. So to kick us off, Chauncey, if you want to go to the next slide. So just a little bit of kind of like what public health is. I know we've got an actual public health major on the call, so don't judge us too much on this for getting it really granular and really elementary, but really it's just about protecting and improving the health of communities. It's a lot of public health is about prevention. And, I think everybody got a bit of a crash course in public health during the COVID epidemic, which we're still technically in, but everybody says it's over. So, we're still kind of dealing with a lot of that. But, public health is something that I think plays a part in everyone's life, that even though they may not really think about it. So things like the fact that we wear our seatbelts every single day, that was a public health campaign. The fact that you can't smoke in restaurants anymore. I mean, I'm dating myself a little bit, but when I was a kid, there was definitely smoking sections in a restaurant. And it's like 2 feet that way you could smoke and 2 feet this way you couldn't. But the fact that things like that don't exist anymore, certainly a public health campaign. So it impacts us in our everyday lives. And it really is just kind of about the prevention to help ensure that communities stay healthy. Next up, so this is just a brief overview of the different degrees that we offer. So you can see we've got a Master's of Public Health, an MSPH, which is a Master's of Science in Public Health, and PhD programs. And today we're really going to focus more on those master's programs. The main difference between an MPH and an MSPH is that if you know for a fact you might want to go on to grad school and pursue, go on post your master's program and go on and pursue a PhD, the MSPH could be a really good plan for you, as that one is really designed more for a lot of research and more quantitative skills. Whereas if you think, for a fact you want to enter the workforce immediately upon, graduation of your master's degree, the MPH could be a better track. It's more of a terminal track. Not to say that you can't do one or the other, and either one. It's just, the MSPH could be a recommended track if you know for a fact you want a PhD. So you can see, go back one more. You can see the different academic departments that we have listed here. When you apply to the program, you're going to apply directly to one of these. So you can kind of think of that like your major. And so, we really encourage students to be pretty familiar with these when they're applying, because it's not impossible, but it's pretty difficult to shift afterwards. So you'll want to have a good sense of these. And we're going to get into a little bit more detail into each one of these, but I'll also do a plug, and before we leave the session, we'll drop a link for you. We will be doing hour-long info sessions on each one of these departments over the course of the month of October. So if you're kind of leaning towards one or the other, or not really too sure where you would fit in, those would be great events to attend. And then, you can see here on the left-hand side of the screen, we've got all of our different dual degree programs. So if you're thinking, I might think about law school or med school or PA school or anything like that, you can see here we've got all of these different academic programs or opportunities that allow for all of that. So the way that our dual degree program works is you have to be accepted into both schools. So taking the law school, the JD and PH, for example, you would apply to the law school and you would apply to Rollins for the MPH program. If you get accepted into both, you can do the dual degree program. And with most of these, you start out in like the MPH is kind of like the secondary. So for the JD program, for instance, year 1 would be there. Year 1 and year 2 would be at the law school. Year 3 would be at the MPH program. And year 4, you're back at the law school to wrap up. So it basically shaves a year off the MPH program, doing that as a dual degree. And then over on the right-hand side, you can see certificates and special programs. If you think of your academic department that we talked about just on the last slide as a major, you can think of these as minors. And so this is a really good way, if you know like an exact area of public health you're really wanting to drill down into, you can utilize your electives to complete the certificate program requirements for any of these and really drill down and get into kind of like a niche area of public health. So we mentioned our academic departments earlier. This is just kind of showing how interdisciplinary public health as a field is, and to kind of give you a little bit of a sense of what each one of these departments means, what these departments mean. So for instance, BSHES, behavioral science, health education, and we're going to take the topic of heart disease and kind of look at it through the lens of each one of these departments. So BSHES, they're going to be kind of the boots on the ground, working directly with populations. They're going to come in and say like, okay, there's clearly high rates of heart disease in this population. What is a needs assessment that we can do to figure out what it is that the population needs to know? What is the program that we can develop and implement and educate people on how to prevent this? And then what are the evaluations that we can come in and do to see how effective this was? Biostats and informatics is really more than numbers people. So our biostatisticians are the ones that are making all of the data in public health, making sense of it and making it usable for everyone else so we can make good decisions using data. So if you're a numbers person and really like that quant side, bios could be a good pick for you. Epidemiology is kind of like the disease detectives. These are going to be the people that are coming in and really kind of plotting out, okay, if we don't take X, Y, and Z actions, then this disease is going to spread to this many people in this population, or, you know, have this sort of impact across a population. So really, they're really doing that kind of modeling to kind of figure out how we can prevent it from further spread. Environmental health, you know, looking at heart disease, they're going to come at it and be like, okay, is something in the soil causing high rates of this? Is something in the air quality causing all of this? They're going to be looking at the environmental factors around and how that's impacting the health of a population in that area. Health policy and management, obviously coming at it from a policy side. You know, how can we write policy to prevent this or to provide care for people that are impacted by this? On the management side, you could be looking at careers in consulting and possibly even more on like the health hospital administration side as well. And then global health, they're really looking at health disparities. So one of the phrases that they use that I really like is glocal, which means globally local. So they're, you know, you're obviously coming at it from an international perspective and perhaps, you know, working in international populations across the world, but then really kind of drilling down into those populations and figuring out, okay, is there a higher rate of heart disease in this population because of certain extenuating circumstances? And that's just like a one sentence description of each one of these. So that's why we're trying to do like a longer session on each one of these later in October, because really we could talk for quite some time. So I feel like I do them a little bit of a disservice by just boiling them down to that. But hopefully that gives you a good sight as to how interdisciplinary the field is itself. So we are the top fourth ranked program in the nation for public health. We're really proud of that. But what I wouldn't encourage you to, I don't want you to make any decisions on your education based on rankings alone. But our number 4 ranking is something we're very proud of. And things like research, if you want to pop onto the next slide, things like research are something that plays into those rankings. And we're really proud of our research. We have 26 different centers for research here within Rollins alone. And we've got these kind of give you a sense of what some of those cover. You can see AIDS research, water and sanitation, diabetes. There's so many others. So if there's an area of public health or an area of research you're interested in, chances are a faculty member is doing that here, and you would have the opportunity as a student to be involved with that. We're going to flip through a lot of these a little quickly. Oh, let's leave it here. That last one was just kind of talking about all the money that we get, which is great. But I'm more concerned about getting you guys the rest of the information. So our student life is super engaged, and we've got, actually, this is outdated. We're up to 18 student organizations, so we'll have to get that updated. But our student orgs are super engaged. It's everything from, we've got the Association of Black Public Health Students. We've got Environmental Health Coalition, our Latinx Alliance, Students for Social Justice, the Outbreak and Response Team. And that's just a small listing. So these are student orgs that are doing social events, that are doing professional development events, that are bringing in speakers. So it's a really good way to get to know your student colleagues, which is fantastic because at the end of the day, public health is a really small world. So you're really getting to know your student colleagues because these are going to be your professional colleagues upon graduation. So I think having an opportunity like this to really develop those relationships early on and to get involved in the public health world in this sense is really important. Our faculty members, I can't do a presentation like this and not talk about them. If I cut this slide, I'd be in big trouble. So we have really engaged faculty members. 200 of them are full-time. And we like to point that out versus like adjunct, because these are faculty members that are here doing just this. Their job is to teach students. And anecdotally, what we hear from students consistently after we talk with them after graduation is it was the faculty engagement and the faculty relatability and how easy it was for students to to work with them that really kind of, stood out for them about their Rollins experience. So our faculty members are, they're helping students with, obviously classes and getting through that. They're helping students find connections for jobs and internships and practicum experiences. And so they're really here to help and to engage with students. And so I think that's really important. And then following along some additional support, each academic department has at least 2 academic advisors. We actually call them ADAPs. It's one of the 8 million acronyms you're going to hear around here. We tend to speak our own language. And so our advisors help you with course curriculum and making sure that everything's kind of laid out for you and you understand what you're signing up for and that you have the right curriculum choices made. They're helping connect you with resources if you need tutoring, if you are looking for some mental health resources, if you're looking for ways to get involved on campus. They're going to be doing programming to connect you with faculty mentors and things like that. So you really do have somebody to really help you walk you through this program. You're not just going to be thrown in and like figure it out. You're going to have that assistance. And then we've got a phenomenal career development office. That's full-time staff members of, I think, about 7. And you can see here, just these are some of the services that they offer. And then if you want to go to the next slide, I'm not going to read this obviously, but I just wanted to give you all a sense of the breadth of events and workshops and recruitment opportunities and lunch and learn services. This is from last spring, and this just kind of gives you a really big idea of all the different ways that our Office of Career Development helps students. And these are lifetime services. So you graduate and then 5 years down the road, you're thinking, oh, I might want to kind of change up what I'm doing. You can come back and utilize our career development offices and really, be able to stay engaged in that way.
Wow.
And speaking of alumni and working, it's hard to talk about Rollins without also talking about the CDC. And so it is literally next door to us. And so we've got about 1,200 alumni currently there at the program right now, or at the center itself. And we also have current students working there part-time as part of our student employment. So skip through some of this. I do want to talk about REAL. REAL is Rollins Earn and Learn. It's one of our funding opportunities. And the way that you would apply for this if you're a domestic student is just by ensuring that your FAFSA is filled out. And then if this is part of your financial aid award, you're eligible to apply for our REAL jobs, our Rollins Earn and Learn jobs. And we've partnered with about 50 organizations across the city, including the CDC, including faculty members here for research opportunities or jobs that they need help with, public health departments, NGOs and nonprofits that offer public health services. So our students are getting the opportunity to get real world public health experience while earning their degree and working part-time. And you can earn up to $3,000 a semester or $6,000 in an academic year on that. And then this just kind of gives you a sense of where our students are going after graduation and what their, the different areas and sectors that they're getting into. And so let's skip through the next several. Yep, keep going. I want to get to the actual application process and then we'll open it up to questions. So for those of, I don't know when everybody's kind of thinking about applying, but if you're looking at applying for this coming fall 2024, this is where you'll want to certainly perk up and make sure that you're aware of some of this. So our application is through SOFIS, which is a centralized application service. You can apply to up to 3 programs. You'll have to submit official transcripts. If you are an international student, any transcripts, any university schooling done outside of the US would need to be have a WES evaluation that goes along with that. 2 letters of recommendation, although we accept up to 3, and standardized test scores are not even considered. So no GRE. Everybody can stop thinking about that and stop stressing about it. I see that, Chloe. I'm with you on that. Our biostats department does accept it as an optional, but all the rest of them, it's not even considered. And then you'll submit a statement of purpose, kind of like your personal statement. And then you'll have an opportunity to give a resume with research, work, volunteer, anything else you want to share with us. And then next up, we've got, if you are an international student, as we mentioned, you've got to submit your WEST evaluations, language proficiency scores, as well as financial certificates showing 1 full year funding for 1 full year of study. So with that, oh, and then yeah, let's talk about this. This is important. So our priority deadline is always going to be January 5th. And we will only get your application from SOFIS once it's deemed complete. And then once that happens, it takes about 2 weeks for them to verify before they submit it to us. So you really want to be thinking about getting it into SOFIS by like early December, late November, in order to meet our priority deadline. And that would get you considered for our merit-based awards. No additional application for scholarships, but getting it in by that deadline is the big key one. So I'm going to go ahead and we'll leave this slide up just so that way you can kind of read about the financing part. But I really want to have a chance to get some questions. I know I ran through all of that really quickly. Being that we just had about 30 minutes scheduled for this, I just want to make sure that since we've got a small group on here that we can actually have a little bit of a conversation and answer any specific questions you all might have about the program itself, about the application, anything like that. So since this is a small group, if you would just want to raise, do the raise your hand thing, or just even come off mute and just yell out your question, because it's not like there's a lot of us. So I'm going to go ahead and turn it over to y'all for any questions that you might have.
Okay, I'll go. Thank you so much for
Absolutely.
this, because I was actually really, really informative. Like a lot of the questions I had, I was like, oh, you answered that. You answered that.
Oh, great.
But one question I had, and it might differ, I guess, depending on the department, but do you know, like, usually the length and type of experiences that most applicants have before they start applying to your school?
Yeah, so, it's some students are coming in directly out of undergrad and some students are coming in with work experience. So average age of our student is 25, if that kind of helps. And I think that's kind of, evened out by those that might be coming in directly out of undergrad. So we don't have like a set work experience requirement in terms of like, you got to have a minimum of 1 or 2 years or anything like that. So, and you are right, Chloe, in the sense that like every department will review. So let's say you're applying to epidemiology. That is going to be the department that reviews your application. So our website does have a few of the like additional requirements or prereqs that some of our departments might have. Biostats, for instance, is going to want to see like linear algebra, and I think going up to Calc 2, and epidemiology is going to want to see at least one college level science and college level math course. And that's, I think, preferred is biology and calculus, but not, those aren't required. You just got to have something that kind of falls in those lines. So there's no like set work requirement or anything like that though, that you have to worry about.
Thank
Hey, Lillian,
you so
what's
much
up?
for this presentation. Hi,
Yeah.
just want to say thank you so much. It definitely seems like a really great school. And thank you for all the enthusiasm. This is a really informative presentation. I had a question about the capstone project that students complete as a part of the Master of Public Health. I was wondering if you could speak a little bit more to that.
Yeah, so that's going to, again, vary by department. And so it's really, some students might do it as a thesis, and some might do it as like a actual project. So rather that's like, maybe doing some type of analysis or, project, program implementation through a Department of Public Health or something like that. It's really going to vary on the department and what their requirements are. And so you would work with your faculty member with, you'll kind of be assigned a faculty member within that. You'll work with them to figure out what that would be, and then they would kind of be guiding you through that process. So kind of, again, going back to the whole support, none of this is anything that you're just going to be thrown out and expected to know or expected to handle on your own. You're going between your academic advisors and faculty advisor and just general faculty support. You'll have people guiding you along the way and help in like, so for things like our applied practicum experience, which is called APE, like our career development office is instrumental in helping students identifying those options, and same with like internships or anything like that. So, it's not like you're just left to your own devices to figure it out.
Great, thank you so much. I'm gonna figure out how to turn the lights back on.
Here, we just have to like wave wildly and flail our arms when the motion takes it off.
There we go.
There it is.
I have a question about aid, if I could ask that.
Yes.
You know, I see that there are merit scholarships. Can you talk about kind of the scope of those, like how, like what percentage of students
Yeah.
qualify, what size of the award, what are we talking about in terms of tuition? If you could help shed some light on that.
Yeah, for sure. So our merit-based awards, again, as long as you get your application in by that January 5th deadline, you will be automatically considered for those. They are quite competitive. And so the one thing that we kind of like to align expectations of with students when they're applying to graduate programs is that the funding opportunities that are there at the undergrad level unfortunately don't often carry over to the graduate level. So, you know, as much as I hate saying that and as much as I hate that, that is the reality of the situation. So that's all the more important to get that application in by that January 5th deadline to be considered. So they are quite competitive. Those awards range from anywhere between $30,000 to a 50% tuition coverage, to a 75% tuition coverage, to a full 100% ride. Now those 100% rides, we're looking at like maybe 10 students for that one. So that one is like obviously the most competitive and the most highly sought after. When you are getting your application in by that priority deadline, you're not going to be applying to, you know, since there is no scholarship application, you're not applying to anyone in particular. You're just going at all of those students that get in by that deadline will be considered, and then they would be then determine what scholarships you would be offered or at what level. So the 30,000 and the 50%, you know, those have much higher rates of offerings. Those may be, you know, we could offer maybe 150 or something of those in a year versus the 10 full cover, you know, full rides or something like that. So we do just like students to understand that it is quite competitive, and it's not anything that is guaranteed, unfortunately. If I had a big giant blank check, I would happily write it for everybody. But we just don't want students, you know, coming in expecting certain levels of aid. And all that to say, though, on our website, in our tuition and funding section of our website, there is a link to a really good resource. It's called the ASPPH Scholarship Finder. And we'll drop a link in that before we close the session out today. And that one is one of my favorites. It's external scholarship research. And so that's what I would really encourage people to do, is to also think about some external funding opportunities and not rely solely on institutional funding. Just because institutional funding across the board, regardless of what programs you may be looking at, institutional funding alone may not be sufficient to meet whatever your financial needs are. So finding some external opportunities is a really good way to kind of make sure that you're filling in those gaps. And the ASPPH Scholarship Finder is great because you can search based on, you know, your country's citizenship, your experience, the area of public health you're looking to go into. Like, it really aggregates all that together and makes it a little bit easier to find.
Great. Yeah, if you can drop that in the chat,
Yeah,
that's amazing.
We'll drop that link, and then we're also going to drop our events link, which takes you to any of our upcoming virtual events as well. And I'd be remiss if I didn't, because it's not like you guys are super far. I know you're not close, but you're not far. October 13th is Destination Public Health, which is our in-person open house for prospective students for this fall. And it's kind of a day of activities. It's from, I think, 10 a.m. to 4 p.m. We have our dean speaks. We give a presentation on the application process. We talk about funding. We have a student panel. You get to go to an academic department meeting that would be like of your choice, you know, the one you're most interested in. And you get to hear from faculty and staff within that one. We do campus and building tours. We serve you lunch. So I know that it could be a little bit of a hard ask, but I just wanted to make sure that everybody knows about that. And I think Chauncey's getting some links in for that as well. If you can come, we'd love to have you all.
Okay, Aisling, thank you so much for asking that question, because it led to a few more about aid. So it's kind of like 3 different questions rolled into one. So if you get outside funding, does that reduce your institutional aid at all?
Not,
Okay.
not in the least bit. We
If
wouldn't
you
punish
have-
you for being that awesome to get
Okay.
additional funding.
Awesome. If you get a high aid package, does that still allow you to be eligible for the Rollins Earn and Learn program?
Yeah, so there's kind of two separate things. The real program, the only way that's more or less of a first come, first serve. And the way that
Okay.
you get access or considered for that one is through filling out your FAFSA.
Okay.
So, and that's if you're a domestic student. If you're an international student, then you would just, if you get your application in by that priority deadline, then you will get an application link from us to apply for real. So, and also just as a side note, y'all, FAFSA is changing their deadlines. I don't know if y'all are aware of that. Okay, I see some nodding. It's going from like October to December. So like, just be aware of that and be on top of that, because the sooner you get that FAFSA paperwork in, that's what's utilized to pull who we select for real.
Also, what time do those aid packages get sent out to students?
So regardless of when you get, like, let's say you start your application the second we get off this call, which I know everyone's going to be doing, and then you get it in and get it done and it gets to us within the next month and a half. We don't start releasing decisions until mid to late January. So, you know, we have that priority deadline of the 5th, and then mid to later of that month, that's when we'll start releasing those decisions. And then we kind of do it on a rolling basis from there as space is available in the programs. Aid itself, you would find out from us on institutional awards, so like the merit awards, things like that. That's mid to late February. And then it's usually March-ish, like early March, when the FAFSA, for if you're a domestic student, that's when you would get like your actual financial aid package of like, okay, you've been awarded this, you know, you have the opportunity to take out this much in loans, or you've been awarded this whatever as part of your financial aid, like federal package.
Okay, and then what would be the usual time? Like, let's say you were accepted, that you would have to say like, yes, I want to come.
April 15th.
April, okay, awesome.
And that's kind of like the across the board for most schools of public health. That's like the end all be all date for most of the programs that you would be probably looking at through SOFIS.
Okay, awesome. Also, is there like housing assistance? Where do students usually live when they?
Yeah, so one thing that's really exciting is that Emory is about to open its first ever graduate student housing. So this whole time that Emory's been in existence, we've never had grad housing, which is so weird to me. So our students have always had to live off campus. And so, you know, we do have a really good resource for that. It's called the Emory Off-Campus Housing Finder. And that's where you can look for apartments and, you know, like actual big apartment communities, or maybe if somebody's like renting a room or like renting a basement apartment or something, you can find roommates through that. But starting in this coming fall of 2024, Emory's, assuming that construction continues to go on time, but who knows with that. But in theory, we are being told that for fall of 2024, Emory's on-campus housing for grad students will be open. So you would have the opportunity to do that. I don't know the pricing of any of that yet. I don't even know if they've released it. So I can't really say if it's competitive to, you know, if you found external housing, you know, more just like an actual apartment complex or something. You know, generally anything with roommates is going to be cheaper than not. So I'm not too sure what that looks like just yet. But I know that they'll probably get all of that out here pretty soon, as soon as they know for a fact that they can open up, you know, leasing for it.
I have some more, but I want others to ask questions if they do. I don't
I
want to
keep going, Chloe. If anybody else has, throw up the digital hand or just interrupt and say, hey, I'm next.
No problem. I was trying to gather myself together. What is the usual time that students kind of finish their whole like MPH, and is there anything in place like in case, let's say you have a medical emergency and you need to like extend that, like, you know, what's the whole process?
Yeah, so traditionally our program is right at 2 years. We're not really considered like a cohort style. So like when you, let's say for instance, again, we'll go back to epidemiology. You start next fall as an epidemiology student. the people that you start with will generally be the people that you graduate with. You're not necessarily going to be going through every single class in lockstep succession with them, but the way that the program is designed is it's 2 years, it's going full-time for 2 years. If something comes up, if you need to do a withdrawal, if you need to do a pause, if you need to do anything like that, we absolutely have the staff and the resources to help you with that and to make sure that, you know, you're not just like dropped from all your classes or, you know, things like that. So if something were to come up, those are always just dealt with on a case-by-case basis. But we certainly, you know, you wouldn't be the first student that had to pause studies and come back.
Okay, gotcha.
Yeah. And also, I meant to say this earlier, but I got very sidetracked because all of our IT stuff. But I wanted to introduce. I know Chauncey introduced herself earlier. She just started with us last week, so I felt like it was weird that I'm doing all the talking and I'm not. It's not that I'm not letting her.
I'm just here to post links in the
Yes.
chat.
She's very good at that. I meant to say that earlier, and now I'm just realizing, man, this looks really weird. You're just running your mouth and not letting this poor person talk. So she just started with us a week and 2 days ago, something like that.
Something like that.
Yeah. So you know, that's kind of some context behind that.
Okay, that is related to something else I was gonna ask. Like, why did you both choose Emory? Because I was doing like a little cyber snooping and I saw you, Emily, you had been with Emory before, and then
I had.
came back.
Thank
So
you.
I was like, why did y'all, you know, choose this
Okay.
school?
So I was at Emory from basically in Chauncey's role as Associate Director of Recruitment Admissions from 2013 to 2017. And then I got a really good offer and opportunity from Georgia State University here in Atlanta that I couldn't pass up. And I left only because of the opportunity, the career growth. There wasn't anything going wrong or bad at Rollins. I loved Rollins, but it was such a good pay bump and a good title jump that I couldn't pass it up. In that time at Georgia State, Chauncey started working there and she was on my team. And then I left and came back to Rollins. My old boss here from Rollins, you know, reached out in October of last year and was like, hey, you know, we'd really like to think about you coming back. What could that look like? And so I jumped at the opportunity to come back, and I loved it here. I loved Emory. I loved Rollins. I feel a lot more connected. I was at the business school at Georgia State, and nothing against that, but I just feel much more connected to the mission of public health and specifically to the mission of Rollins. And I felt much more connected to the students. So I was really happy for the opportunity to come back. And so I did that back in January of this year. So I'm coming up on eight or 9 months or so of being back. And over the summer, when an opportunity came up to hire for a new associate director, I reached out to my colleague from Georgia State and said, you want to come with me? And she did. So here we are, a week and a half into her tenure here.
Yeah.
And I don't know if you have any insight on what you want to add on why you came over to Emory. I mean, clearly it was me, but
Yeah, a little bit, Emily. It was also, you know, career growth and all of that. But also, I mean, being on, you know, the Emory campus and Rollins specifically, you know, the culture on campus is phenomenal. I highly recommend if you're able to come and visit campus, because you can definitely feel like, is this my vibe kind of thing? Yeah. And the vibes are immaculate.
We work hard on that.
Yeah. But no, I mean, it's obviously, you know, a very competitive university. And just everything I've experienced in my whole like week and a half is the staff and the faculty, the leadership, everybody involved cares so much about the students and the mission. And that's exactly what you want out of a graduate program, right? Yeah. So all of it's been, you know, fantastic. I made a good choice. No,
Good answer. Good answer. But I also would say, like, that's one thing, you know, Chauncey kind of mentioned the staff and the faculty. And I shared a lot of that in the presentation of the overall support. That's also pretty unusual at a graduate program. You know, a lot of times in grad programs, you're just kind of left to figure it out. And we don't want that. It's not that we're holding your hand, but it's that we're here to support and make sure that you have what you need to be successful.
Also, okay, that's happy to hear that. And all the genuine laughs, that's a good sign.
It's very forced.
I'm happy to hear that. I know that there are also a lot of initiatives to kind of just promote like diversity and equity. So I was wondering if the recent like Supreme Court decisions have impacted the way you vet your
Ooh.
application.
Yeah, it is. I mean, we're still reeling from it, and we're still figuring out what it means for us. It's created so much uncertainty in our admissions world. We're having to loop in Emory's attorneys. We're having to loop in, we're working with our colleagues across other schools of public health. We're really trying to figure it out, and what our immediate impact of what we know we can do, at least on our end, on the admission side, is we're really trying to make sure that where we're recruiting meets those needs. So like we just had a staff member that went yesterday to an event at FAMU, Florida Agricultural, and I can't remember what all that one stands for, but it's an HBCU in Tallahassee. We're working very closely here in Atlanta. We've got a consortium of our HBCUs here, Morehouse, Spelman, and Clark Atlanta. So we're doing events with them. Tomorrow I fly to Kansas City, Missouri, to go to an event with them. I don't know if any of you are familiar with the McNair Scholars Program, but it's one that really focuses on underrepresented students from a wide, whatever that means, from a wide variety. So, not just ethnicity, but, background in terms of like socioeconomic. So we're really trying to make sure that we're hitting events and getting in front of populations that may not have traditionally been, considered for this and been, this is something that would have been on their radar. So that's our immediate kind of way to address this, as we still try to kind of walk through and figure out what it means, overall. Because you're right, it was a big blow, and we didn't really know where we were going to go with it, and we're still walking through that.
Mm-hmm. Okay. Got you. Thank you for that. And that's an honest answer, because that's been happening so recently. So I've been wondering how admissions have been trying to reconcile.
If anybody tells you they got it under control, they're not telling the truth.
I got you. It also might be more department specific, but and I think it might have been a slide that we just didn't get to touch, but with labs and funding, like, have you guys ever run into a situation where a lab ran out of funding? Where do just specific departments kind of get that from? Like, how does that process go? Because I know that does happen to some schools.
Yeah, so our research labs aren't really tied to our academic departments in that sense. Okay. So, if a faculty member was doing, had this big, huge project and lost their grant funding, it's not going to, immediately impact what the epidemiology or the health policy management program can do academically. That faculty member may have some impact in their actual research, but that's not going to impact the classes or the size or the scope of what we can do academically.
Okay.
But if you were maybe like a graduate assistant assigned to that faculty member as that research project, that's a different story, that might impact you, and maybe your assistantship might go away or something. But in terms of the actual classes or academics or programs like that, there wouldn't be an impact.
Okay, awesome. And do you have any, I guess, like numbers for the actual graduation rate, and like what % of students are working full-time, like right as soon as the program ends?
Yes. If you want to go back, let's see. There we go. So, 96% of our students upon graduation know where they're going or what they're doing, whether that's continuing education or have a job lined up or something like that. So, thankfully, it's a very small percentage that don't know. And I like to also think some of that could just come from they didn't fill out our survey, so it's hard to know. Yeah, and this just also kind of gives you some average base salary as well. The one thing that we like to remind students of, if they're thinking that these may look like low numbers, is that this is for immediately upon graduation. So like, this would be like your first job post graduation with your MPH. So it's not to say, this is like long term or anything like that.
Okay. And the CDC is one of the main partners you usually have if students want internships and practice.
Oh yeah, we've got current students working there. We have 1,200 alumni over there working full time. It's a very big partner of ours, and certainly one thing that is, I think, a huge draw for a lot of students.
Awesome. All right, those are all my questions. Thank you so much.
All right. Thank you, Chloe. I love it. I love it. All right, Lily, I see you just went off mute. You got anything for us?
I just wanted to say thank you so much. I have to head to cross country practice, but I really
Oh.
appreciate all the information.
All
Thank
right, go run
you.
super hard. All right. Good luck. I don't know what
Thank
to
you
say.
so much.
Yeah.
Appreciate it.
Stay
Thank
hydrated.
Thank you.
Thank you so much, Emily and Chauncey. We really appreciate it. This was an excellent presentation. We've had a couple now come through. So thank you. Thank you. It
Oh,
was
I'm so
very well
glad.
done.
And Chauncey, can you drop our emails? We're gonna drop our direct emails, so please feel free to reach out. And Ashley, and I know you have mine as well, so feel free to drop that.
Okay.
You know, with any students that couldn't come to this or anything like
Yes,
that.
I have one that was kept trying to get in during the program, but couldn't get in for whatever reason. I don't know why.
I
Maybe
wonder if the same thing, who knows
No.
what was going on with mine. I'm gonna have to figure out my Zoom clearly. So, but yeah, so those are our emails. So please feel free to reach out. We're happy to talk. And like I said, I also want to do another plug for Destination Public Health. If you can get to Atlanta for that Friday, it's going to be great.
Okay, and one last question. I always encourage students to reach out to the admissions offices at the various graduate schools that they're interested in to kind of go over the experience they've had and see if they're ready for, if they seem like a strong candidate for admission. Before
Yes.
a lot of them are nervous and feel like they're not qualified. And so I want them to hear it from you that yes, they are.
Yes.
So you do make yourselves available for those types of conversations, right?
Absolutely. Absolutely. We can set up a Zoom, we can chat and just talk a little bit more in depth. But really what I would say is, I mean, if you're coming out with an undergrad degree and you want to do public health, chances are you're going to be a good candidate for one of our programs. It may not, if you want to do biostats and you've never had a math class in your life, that's a different story. So we might have you think about a different department, but there's opportunities there.
Yeah, perfect. And if students should apply and aren't offered a seat, because maybe they're applying straight from undergrad and haven't had any relevant experience yet, it's encouraged. I asked this question. I'm hoping it's encouraged that they apply again. Yes.
Absolutely. Yes. And with some of our programs too, like you will have the option to apply to up to 3. In SOFIS, like the application itself, you just put your number 1 choice. And then once we get that application, you'll get an email from us with a way to give us your second and third choice. And the way that works is let's say you pick Epi as your first one, epidemiology will review it. If they say no, then it will go to your second choice and it will get reviewed there. And then if they say no, it will go to the third choice and get reviewed there. So you won't be reviewed for all 3 automatically and like kind of offered your choice. It's going to be based on like how you rank them and what you're selecting from. But what I can say is for some of our programs, like again, going back to epidemiology, they have an MPH side and an MSPH side. If you apply for the MSPH and they're like, oh, you're not quite there for that, but you'd be a great MPH candidate, you're not going to have to reapply. They're just going to come back to you and say, would you like an offer for the MPH side versus the MSPH side? And so you don't have to like waste your second and third choices on MPH versus MSPH or something like that. They'll just kind of they'll look and be like, okay, we think you'd still be a good candidate on this side, just maybe not for MSPH.
Okay. And do the different departments know where they are in your ranking, or do they not know that?
Because it only gets sent to them, like say for instance, you apply to Epi, you don't get in, so then it goes down to health policy management. They're not going to be notified that, hey, Epi denied. Now,
okay, that's good. That's good.
They're not going to care because they want to build their department with good students. And if you're a good candidate for them, great. It doesn't matter that Epi said no or whatever. That's really not even that. Even if they did know, it wouldn't be taken into consideration.
Okay, that's really good to know.
Mm-hmm.
Well, I know we've run the clock here. We're almost at an hour. Chloe, did you have one last question?
Yeah, I had a quick question. Is there an interview process at all? And then also, are there opportunities for a fee waiver for SOFIS?
So SOFIS does on their website, they do have an opportunity to apply for fee waivers, and there's certain requirements that you have to meet to get that. So you can apply for that there. But there is no interview requirement for us as part of the application process.
Okay, awesome.
And I
Megan,
think-
take advantage of the funding at Davidson right now before you
Say that one
graduate.
more time.
I was like telling Legan, take advantage of the funding at Davidson right now before you graduate.
Yes, absolutely. And I think Chauncey was gonna post the link for the Sophus fee waiver. There it is. Yeah. And so she's gonna pop that link in so that way you can kind of get a sense of if you'd be eligible.
Okay, awesome.
All right. Well, thank you. Thank you all so much. This was a pleasure. I always love when we get to kind of do these small ones and get to kind of interact like this. A lot of our sessions are on webinar based, so we never really see anybody. So I really love these small sessions. And Ashleen, if you know, anytime you want to set another one of these up, if you think it'd be good to do another one in the spring, we can certainly do that.
Let me chat with students. Yeah, I definitely think, I mean, right now we're kind of hitting the students that are thinking about applying right now, right? I would love to get to underclassmen who are interested in public health first and second, get them thinking about these types of, you know, your program and others well in advance of the application time period.
And
So
can you also defer if you have been accepted now?
Yes. Yep. For 1 year. But in order to defer and to kind of keep your seat, you do have to pay the deposit, which our seat deposit is $400.
Okay.
So you can defer and then just start the following year.
well, that's
Okay.
that's great.
Mhm.
All right, awesome. Well, thank you again. It's so nice to put a face to the name too. I look forward to talking with you and thank you. I'll be in touch about a spring program. Okay.
Yes. Awesome. Thank you all.
Bye.
Thank you.
Bye.